I want to talk a little bit about the pushback in the general population to having fillers. Injectable fillers, there's a big movement now to avoid them. And I think the main reason for that is because people see others that look abnormal, especially celebrities. So first of all, let's talk about how celebrities get that way. First of all, even though you think they're so connected, they're just like the rest of us. They go to somebody that their friend said or somebody that their publicist likes or whatever it is. And then you've got the doctor on the other side or a non-doctor who may be very much in awe of this person and kind of just continue to do what they might want, or they don't realize that they are getting what we call perception creep. So they keep getting more and more because they're aging, and then they wind up having too much filler. It really isn't easy to give too much filler to somebody in the sense that it costs a lot of money. And people wind up who are over volumized often just don't see themselves, and the physician is not stopping them and saying, you are not looking like yourself. So that's one thing. The second thing is it's kind of like a fashion in certain places like LA, Miami, to have big lips and big cheeks and low-cut gowns and stiletto heels and perhaps a very ample butt. And if that's not your style, then you probably don't have to worry about it because that's actually a style that people go for, even though many of us who want to look more natural find it abhorrent. It really takes a lot of skill to inject people so that they look like themselves. And how do we do it? We follow their anatomy. You have a certain cheekbone, you have certain bone structure, you have a certain way that your face looks. What you really want out of a filler is to kind of be rejuvenated or basically restoration, right? What happens to your house over a period of time? Things break, things shift, the paint looks old. This is what happens to our bodies too, even though we're biological creatures. So maybe we need to shift the tissue up a little bit. Maybe we need to repaint and have like a laser resurfacing. But it isn't about changing our house from like the little Tudor cottage to like a mega modern mansion. No, it's about taking your little Tudor cottage and just updating it on the outside and making sure that your lawn is nice, putting in a few more trees or hedges. So the point is that, number one, you don't need a lot of filler. Number two, you don't need to have anything more than something that is going to restore your own proportions. And number three, the way to get that is to go to somebody who's very experienced. And usually that's going to be a board-certified dermatologist because we are physicians and we inject people. We aren't like, I hate to say it, plastic surgeons who most of the time don't actually inject their own patients. They have nurses do it. And not to say anything against nurses, because some of them are incredibly talented, but you should go to the person that really understands the anatomy and not has learned how to do fillers, but actually understands what's underneath them, how the face is structured, how it's going to look when you talk. And so you can actually get a result that looks like you. It should be inapparent to anybody that you've had a filler. And that is what good work is. And that's a problem for us because when you have really good work done, nobody can tell. They just know that you look good. Oh, you look so good. Are you rested? Did you get a new haircut? Did you get a new pair of glasses? Did you lose weight? These are the common questions that people get when they actually are done in a really expert fashion. The next thing that's happening lately is the plastic surgeons are now going to the big magazines and saying, oh, there's still filler in your face from 10 years ago. That's bad. It could be toxic. Well, guess what? It hasn't been toxic, and maybe that's good. Because after all, we all thought our fillers would disappear in a year, and maybe if it's still there, it will be cumulative, which is what we see in our patients. For instance, you come in one year, you get maybe 3 syringes of filler, and next year maybe you get 3 syringes of filler, and then the next year you only need 2 syringes. And the following year, 2 syringes, and maybe in another year, maybe you only need 1 syringe. Why would that be? Because you're getting older and older and older. The reason for that is there is a cumulative effect. First of all, it does stimulate collagen underneath, but second of all, some of it probably doesn't go away. And that might be a good thing. But they're saying to everybody, oh, we can't do our facelifts because it's accumulated underneath the skin. And then when we go in and we cut you open, we have to pick it out. Or when you have an energy-based laser to tighten your face, now you have thicker collagen and it's harder for us to cut through it. Well, boo-hoo. Too bad for you. You're going to just need to get a much sharper scalpel because after all, I don't know too many women who are actually going to wait until they're 65 to have anything done so that their face can be pristine so that when their plastic surgeon actually opens them up, it's easy for the plastic surgeon to actually lift their face. So these are all the things that are out there now. Like, I don't want to change my face because then I might not be able to have a facelift. You will still be able to have a facelift. It might be a little bit more difficult for the surgeon to give you that facelift, but they will figure out how to do it if they want to continue to do facelifts. And number two, having filler stay in your face for a long period of time may allow us to build on that filler, so it is not necessarily a bad thing. And after all, filler is made out of hyaluronic acid, which is a natural substance to our body. We are not injecting a foreign substance. And a lot of people don't really realize that. So that's the end of my discussion of just how to think about some of these quote-unquote more negative trends in the lay media, in the magazines, etc., and my take on it. Thanks.